All right, you guys, 7:30. So like I included my video. I'm going to have a 5 minute overtime before I close the door and I start my lecture. But this 5 minutes, I can answer questions. I'll review what we did last class and where we're headed for this class, and then also make any class announcements. I have a class Instagram. We tried to use it for class, but it was just too much and some people didn't have it. And so I still have it and I'm going to post job openings. So one just came up yesterday, I think, for Summit Physical Therapy. So they're looking to hire a tech. So if you're interested in that, I think it's KNES 310 underscore 415 or something like that. So if you're looking to have a job or if you want more information, I had it on the class Instagram page. It's also a good way for students, former students, to stay connected to what we did last class, planes and axes. Guys, we have to get our concepts of planes and axes down before we move into especially the illusionary parts of this class that some students will struggle with. If we keep working, we keep plugging, we keep grinding, we're going to get it. But planes and axes are difficult at first because you've never had it presented to you in the way that it is mechanically, and that's dimensions of spin. So a plane is a dimension of spin. You can see a movie, most movies are in 2 dimensions. But if you have the special glasses, you can see it in a 3rd dimension. That's straight line dimensions. The up, down is 1 dimension, the left, right is a 2nd, and then the front, back is a 3rd. All we're doing is we're saying for things that spin, okay? For things that spin, it's not just about up, down, left, right, front, back. It's about how things are rotating. That makes sense? Good morning. Morning. Does that make sense? So how are things spinning? They can spin in 3 dimensions. Sagittal spin occurs about a bilateral axis. If this was a high bar, there's only one way the gymnast could spin, do a full rotation. There's only one way. The gymnast can't hold on to this bar and spin around like this. They could sway, but they're not going all the way around. The gymnast can't spin in the transverse. The only way the gymnast can spin is perpendicular to that axis. Make sense? That's all we're doing, is we're linking dimensions of spin with the point about which they spin about. So bilateral, nothing but expensive props. Bilateral is the axis about which sagittal spin can take place about. We have to have that memorized. We have to associate peanut butter and jelly. Bilateral, sagittal, always. We have to associate anterior, posterior with frontal, always. And then we have to associate transverse spin with polar. We have to memorize at least the plane and the axis connections, and then we can work on understanding the global and the local stuff. All right. So that's number one. The second thing is from last class. I mentioned that planes and axes are global or local, and that's a little weird too. But let me see if I can explain that further development today. Tell any of my former students that I've gotten solved. Right? All right, here we go. Are we moving right now? Well, yes and no, right? Like our planet's rotating and we're moving about the solar system and all that stuff, but we're not moving relative to this room, so you don't feel like you're going, you don't feel like you're moving. That's the essence of local and global references. If you're in a bus and you're riding down the street in the bus, are you moving? Well, yeah, you're moving globally, but you're not moving relative to the bus. In other words, you're in the same seat. In fact, you close your eyes, you go to sleep, you don't even feel like you're moving until they put on the brakes or something like that, right? So it's very similar. We have to understand global references because to understand what's happening in our joints, we have to understand what could look like it's happening to the room or to our surroundings. I'll give you an example. If all you do is know a global reference, you're going to try to tell me this is shoulder flexion and this is shoulder extension. Or this is right transverse cervical rotation and this is left transverse cervical rotation. In other words, the bus is moving relative to the ground, but I'm not moving inside the bus. Another example, and then I'm going to bring Cole to give an example. Clock motion is this hand relative to the clock. This is inside the bus. We have to understand global and local so that we don't say, this is clockwise, but this is not clockwise. The hand is moving globally relative to the room, but it's not moving locally relative to the clock, so therefore the clock didn't move. Does that make sense? That's what we're working towards. We have to see and understand the global so that we can truly understand the local and not get those two confused. Okay? So a global reference, once again, is a fixed reference. We say this is the back of the room and the front of the room. Anterior, posterior, that's where that word gets its name. For me, for my body, when I get in anatomical position, everything lines up locally and globally. The front and the back of a room is the front and the back of me. The side to the side of the room is the side and the side of me. The top and the bottom of the room is the top and the bottom of me. So when I'm in true anatomical position, the anterior-posterior axis that is global to the room is also local to all of my different joints that I have in my body. The anterior part of my neck goes through the posterior, anterior to posterior shoulder, anterior to posterior hip. Make sense? That's the part that's also missing from pictures and textbooks is they look at these planes from the whole body. But you have planes and axes in every joint you have. Okay. Now, globally, it doesn't move, just like north is always north, east is always east. The fixed references don't move, even though I may move. In other words, this is sagittal plane rotation of my shoulder, both globally and locally. That's cool. This is sagittal plane rotation of my shoulder locally, but not globally. This rotation of my shoulder is now taking place in the room's frontal plane. That makes sense? My side-to-side axis is the room's anterior-posterior. That's all I'm trying to get you to see. Let's do this practical example. I love doing practical examples so that you can see what we're working towards. So Cole's going to lay prone and flex your right knee, please. All right. We're going to do a range of motion test for his hip for rotation. Okay. And this, there's some illusions involved. Don't worry about that right now. But this is actually external or lateral rotation of the hip, and this is internal or medial rotation of the hip. In Unit 2, I'm going to teach you about illusions and stuff. The trick, though, is that if I'm checking his range of motion, I want to make sure that I understand it's relative to the ball and socket that's in his hip, right? The femoral head and acetabulum, not the room. So it's common for people to start to rotate and then watch Cole's pelvis. You see how his pelvis starts to move? This is what's happening. When I move Cole's head, foot, he starts here. I'm not going to push it because I have to move the clock. Internally rotate. Now, once he gets to the end of his range of motion, all Cole knows is that he's trying to bring my foot down. So what Cole's going to do is rotate his pelvis to get it further down. But that motion didn't happen here. You had this plus this. Some of it was local, great. Some of it was global. And I need to teach you to only look for the local because that's what counts for the range of motion. Hey, let me check your shoulder range of motion. Does this count if I'm in my back? Does that make sense? People are going to do that. When you're checking, assessing range of motion and movement, people are going to cheat. They don't know any better. Bring your arms up. I got my arm over my head, full range of motion. Well, how much of it was this and how much of it was this? Does that make sense? Okay. So let's practice. Let's practice. Global reference. We're going to practice nothing but global, meaning fixed. On the test, if I say global reference, it's anterior, posterior axis, bilateral, polar. It doesn't matter what I'm doing. It's, am I in the room's frontal? Am I in the room's sagittal? Or if I'm laying down, I'm in the room's transverse. It's not meant to be tricky. It's for us to understand the difference between the two so that we can put it into practice and not be fooled by some of life's illusions that are going to be coming up around the pipe with our joint motions, okay? All right, global reference. Left shoulder. Take 5 seconds. Plane and axis. Frontal plane rotation about the anterior posterior axis. Cool. Transverse plane rotation about the polar axis. Cool. Sagittal plane rotation about the bilateral axis. Questions? Clarifications? It's okay to ask questions, guys. It's okay. Going once. All in, all done. Okay. Global reference. Sagittal, about a bilateral. Frontal, about an anterior posterior. Transverse, about a polar. Sagittal, about a bilateral. Because it's about the spin. Does that make sense? Now, if there's no question about global, let's go to local. With a local reference, the planes and the axes move with you. Meaning, if this is the blue, is the anterior posterior to my shoulder, the orange is the bilateral to my shoulder, and the white is the polar. As I move, all I'm doing is moving my plane. I actually move because this is still the front of my shoulder. Does that make sense? Just because I move to the room doesn't make the front of my shoulder the side of my shoulder. It's the same structures. The medial collateral ligament is going to be the MCL regardless of how I put my knee. Okay? So the planes and the axes move with me. So if I do this, and I do these shoulders, sagittal plane about my shoulders bilateral axis, transverse plane about my shoulders polar axis, frontal plane about my shoulders anterior posterior axis. Does that make sense? So another example, I might do something like this. And I need you guys to understand that even though my arm might be moving globally, my shoulder is not moving globally. There was no rotation happening about my shoulder. Make sense? That would be like me moving bourgeois and the door at the same time. Did the door open or close? No. The only way it opens or closes is if the door moves relative to the wall. Same concept. My shoulders are not moving because I have no local rotation at that joint. Make sense? Same thing. No motion. Practically speaking, my fitness people, especially, you guys know, you may see somebody doing curls and they might have too much weight and their elbows are like at a certain angle. And you're like, it's a good example, right? Globally, it's going up and down. But locally, those elbows aren't moving, right? It's like, man, that's a really good lower extremity workout. Kind of what we're getting at. We need to be able to see where the motion is happening and not be fooled by what's happening up, down, front, back relative to the room and zero in on what is or isn't happening in the joints. Cool. All right. How are we feeling now? Planes and axes? All right, this is what I'm going to do. I'm going to go through and use some verbiage. The way I try to teach is I try to introduce you to a concept, and then the next class we develop it, we practice it. And then I introduce you to another concept that's similar. We practice it, we develop it. So I'm going to go through every major joint in your body, and we're going to talk about planes and axes. This isn't going to be, let me see how I can put this. I'm trying to put your anxiety at rest. We are going to do some practice sample questions, just like you're going to have on the test. That's going to come. Also, don't be concerned with writing down everything I say. This is to practice the planes and axes. I'm not going to hold you accountable to ankle joint motions, knee joint motions. That's in Unit 2. It's about the concept of spinning. It's practicing the planes and the axes. All right. The ankle joint is a uniaxial joint. It's just for practice. What does that mean? There's 3 planes, there's 3 axes, but it's uniaxial. That means it only allows spin in one plane. One of its planes. The sagittal plane. Because this is the front and the back of my foot. This is the side to the side of my foot. And so my ankle has a bilateral axis that allows spin in its sagittal plane. The concept is that if my legs crossed, this is still the bilateral axis of my ankle. This is still the inside of the ankle and the outside of my ankle. So this motion is still in my ankle's sagittal plane. Because the ankle doesn't know any better. The ankle doesn't know. The ankle's like, I'm still doing the same thing. The structures are the same. This didn't become the superior part of my foot and the inferior part of my foot. This is still the inside and the outside. Does that make sense? See if this makes sense. My ankle can rotate in all 3 global planes. Room's frontal, room's sagittal, room's transverse. But my ankle can only rotate in its sagittal. Make sense? You see the difference? All right. Let's go to our knee. Our knee, as I'm going to teach you in Unit 2, is a modified hinge joint. So it has a side-to-side axis that allows motion in the sagittal plane. Cool. I'm going to teach you what those are, and I'm going to teach you why we call them what they are. But also the knee, when the knee is flexed, can rotate about its polar axis. It can be biaxial. You know what the knee can't do? The knee isn't designed to rotate in the frontal plane. Does that make sense? Now, some of you might have played football, soccer. I guess it could happen in any sport, where someone might land on the outside of your knee, and your knee has rotation in a plane that it wasn't designed to move in. That make sense? You know what we call that in science? A bad day. Call that a bad day. That's where you sprain ligaments, right? So just because a joint isn't allowed to move in a plane doesn't mean it can be forced to move in a certain plane. Once again, that's things we need to be aware of. Knowing the joints and knowing their specific axes and allowable planes also allow us to know how they're not allowed to move so we can see mechanisms of injury. Our hip is triaxial. Triaxial. Stop and think what that means. Triaxial, meaning it can move about all three axes. It can move in all three planes. There's the front of my hip and the back of my hip, the anterior, posterior. I'm going to teach you that it's the same as in Unit 2. My hip has a bilateral axis, outside, inside. You see the perpendicularness, right? Axis, plane. And then my hip has a polar. Sagittal plane spin about a bilateral. Frontal plane spin about an anterior posterior. Transverse spin about polar. Sense? Our trunk can bend in all three planes. So my anterior posterior axis is going to be like a side-to-side bend, like a tree sway from the frontal plane. Front to back axis, side-to-side bend. Side-to-side axis, front to back bend. Sagittal plane, tree swaying front and back, about a side-to-side. And then polar, twist. Shoulder, same thing as hip, same classification of joint. Anterior, posterior, bilateral, polar. Elbow, similar to a knee. I'm going to explain the differences, but it has a bilateral axis. So if your elbow is rotating about an anterior, posterior axis, that's a bad day. Not supposed to do that, but it can. You have this joint called the radial joint, and that's a uniaxial joint that's about a polar axis. There's the polar axis. A uniaxial, one plane of motion, specifically the radial joint's transverse plane, about its polar axis. Its polar axis moves with it. Make sense? Your wrist is biaxial. What does biaxial mean? It means it can move in two planes about two axes, specifically an anterior, posterior. There's your frontal, and a side-to-side, bilateral. That's the so what. That's what we're working towards, okay? Make sense? Okay. All right. What I'm going to do now is, let's see the time. Boom, 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 boom. I want you to get into, and it could be groups of 2, it could be groups of 3, it could be groups of 1. I don't care. Small groups. I want you to discuss planes and axes, because maybe you're afraid to ask me a question, but maybe if Cole and I float around, you can ask us a question, you'll feel better. And then I'm going to quiz you. We're going to do some more quizzes, and I'm going to give you some questions like I would ask on the test. Fair enough? In other words, after today, you have to have a good grasp of planes and axes so that we can keep rolling. Fair? All right, on to. Ready? Pray. Cole, let's float around and see if we can clarify the question. This is also a good way to compare notes. That is that of course.
This does a twist. And if you really if you talk these you have seen me on you don't put it you put it just help with it, but you do it just it's fine.
All right, guys. Oh, yeah. Guys, let me hit that up. So in unit 2, this is going to be fun. I'm going to teach you a lot of misconceptions, like this motion that we traditionally been told is ankle. That's not ankle. That's not ankle. I'm going to teach you what that is, the subtalar and transverse dorsal joints. That's like saying you have a skateboard, and part of riding the skateboard are the wheels. So this would be your ankle. But another part of the skateboard is the wobble. And the wobble is not taking place at the same place as the wheel. Your propulsion isn't the same as your balance. So another example, or like what we were talking about earlier, so many people think this is wrist motion, and it's not wrist motion. It's your radial ulnar joint. I'm going to teach you those things. You don't need to know that now, but us understanding planes and axes is going to help us to understand those we call it funky where I'm from, those weird, freaky kind of illusionary motions. All right, real quick, and then I'll do some practice. Someone asked, well, obviously we don't move in robot world, and you know that you can travel north, you can travel east, but you can move in a combination. You can go northeast. Some of your motion is north, some of your motion is east. Planes and axes are the same thing. Frontal, sagittal, combination of frontal and sagittal. That's all it is. Some of this motion was sagittal at the same time, some of the motion was frontal, and it looks like this. Obviously, most of our motions are combinations of things. But rest assured, on the first test, guys, let me tell you how easy the first test is going to be. All of your questions, outside of just understanding planes and axes, all of your joint motion questions are all going to be sagittally based. Flexions and extensions. While we get used to understanding position, motion, flexion to, flexion from, I'm flexed, I'm extended. What does all that mean? We have to have rules. Okay, so we're not going to get into all this kind of stuff until way further down. Okay. All right. So some of our questions, some really good questions, especially about the shoulder. In Unit 2, ball and socket joints it makes sense. They're the most movable, so there's going to be a lot more kind of confusion about it. So just rest assured that when we get into the ball and sockets, I'm going to explain in more detail how those ball and sockets have specific references to the bone. It's going to make a lot more sense. But on the first test, guys, all I'm really asking you to understand, and I think this worked when I was talking to you guys about the elbow. This is what I want you to understand. You have been probably taught that ab and adductions are side to side. And flexions and extensions are front and back and ups and downs and all these global references. And then on the first test, someone is going to tell me that the elbow is ab and adducting. And the reason they're going to say that is they're going to say, well, it's in the frontal plane. And that's where I'm like, well, it's in the room's frontal plane or maybe your vision's frontal plane. But once my arm moves, my elbow's axis moves with it. My elbow is still moving in its sagittal plane. This is still flexion and extension. This is still flexion and extension. The elbow's like, dude, I'm doing the same thing. I'm spinning the same way. So that's really what the so what of what I'm trying to get you to see. That my wrist is flexing and extending. But if I did something like this, some students may say, oh, ulna and radial deviating, because I'm going side to side. Because all they've been taught is side to side means, front back means, up down means. I'm going to teach you things like, guys, it doesn't matter. Well, flexion is when your head goes down. I can have flexion and my head come up. Well, flexion is a decrease of an angle. Which angle? This one, the one in the front, the one in the back. I'm going to make sense of all that stuff. I'm going to teach it to you in a way that makes sense so that it's not confusing. Okay? All right, a couple questions before we go. What plane is always associated with the anterior posterior axis? Don't answer it out loud. Everybody takes time. I just want to make sure everybody or a majority of people get the right answer. So whether it takes you 5 seconds, 1 second, or 10 seconds, what plane, what was my question? This is like when I'm calling an auction and I'm at a certain number and I stop to talk. I'm like, where was I? What plane is always associated with anterior, posterior? That's a question I could ask. And then I'm going to give you choices. And all of these choices are going to be planes and axes. Some of them will get stuff I make up. I make up a plane. I might say air. I don't put that one, but I may make up words. So what plane of motion is always associated with anterior, posterior axis? Frontal plane, always. Even locally. Because again, if this is the front and the back of my shoulder, this is still the front and the back of my shoulder. Make sense? Another thing I want to remind you of, if I ask you about a plane, that's the dimension of spin. Don't give me an axis if I'm asking you about a plane. Don't give me a plane if I'm asking you about an axis. I'm telling you, I'm playing poker with my cards out. So if I'm going over your test, you're like, oh, I just got planes and axes confused. That's on you. I'm telling you, I'm going to ask that. And the intent isn't to trick you. It's to see if you know the difference between the spin and the point about which it's spinning. That's all it is. Do you know the difference between this and this? How many of you have ever seen no trucks with 4 or more axles? That's another name for wheels, the axis about which it's. All right. How many global planes can the elbow rotate in? Give that some thought. Don't answer it out loud. If I asked you, and on the test I put 1 plane, 2 plane, 3 plane, 4 plane, 5 plane, 6 plane. That's what I'm going to do. I'm just going to throw options out there. How many global planes can the elbow rotate in? 3. 3 global planes. I can rotate my elbow in the room sagittal, in the room's frontal, and the room's transverse. It's a good way to practice. But the elbow can only rotate in 1 plane, its plane. It can only rotate in its sagittal. Does that make sense? I'm asking these questions because I think these are good, comprehensive understanding questions. And if we don't know the difference between global and local, I can see how that could be confusing. That's what we're working on. I need us to be able to say that the elbows on both of my arms are doing the exact same thing, even though they may look different. I need us to be able to say my elbows are doing the exact same thing, even though they look different. Eventually, I need us to be able to see that my left hip is doing the exact same thing, even though it might look different. Eventually, I need you to be able to see that this is the same as this. And that starts with understanding planes and axes. Cool? Any questions? Please. Okay, I'll tell you what I'm going to do. Cole and I will float around. If you want to hang out, ask more questions. We could do more practice. But if you got other places to be, then you guys have a safe weekend. I'm going to email the class about Monday. Guys, I'm a workaholic. If I can get here, I'm going to get here. But that doesn't mean I'm going to make you have to get here. But if the roads are dangerous, stay at home. Be safe. I'll Zoom it or I'll post it or I'll make sure to communicate that. All right? Safety first. In the ball, but it only does that because my elbows and shoulders are using.
Confusing me to learn about all the motor development.
You're welcome, guys. I hope that helped.
A little bit. Yeah.
What's it called?
The global reference is a fixed reference. It doesn't move. You're wild. Can I give you an example?
Yes.
Okay, if I told you, listen, yeah, homeless, yeah, that's what I'm, and the homeless is pointing north. That's a fixed reference. I might be north. But north is always gonna be in that fixed direction.
So is that the same way it is with the axis and split?
Yeah.
So if this is sagittal, right, and you want to turn this way, it will still be sagittal.
Well, correct. So the room, and we have that, the sagittal plane rotates about the room side to side axis. Well, that's the side of the room. No matter what I do, I can go anywhere. Those still the sides of the room.
So it matters about what so right people will be for the axis to change, not locally.
Locally, the axis can change it. So in other words, I'll have to use an example. But like if I'm in true anatomical position, remember true anatomical is when the room and my joints are seeing the same thing.
Right.
Okay. This is the room's anterior posterior. This is also my shoulders anterior posterior. But when I move, this is my anterior posterior, but this is the room's bilateral. Side to side.
Change globally.
Yes. So the practicality is when I do this, I'm in the room, I'm rotating in the room sagittal, but I'm right on top.
But you're in your front. Okay. That makes so much more
Yeah.
sense. Okay.
So if you and I, put that down, because I want you to be able to do your work. So let's say, let's say you're facing here and I'm facing here. You're right. Okay, on the count of three, raise it. 1, 2, 3.
This way?
Yeah, you were in the room sagittal. I was in the room's frontal, and we were in both of our quadrants.
Gotcha. Right, we're doing the same thing. Okay, that makes
And
sense.
the reason we have to understand both is so that we don't get, it's our way, the confusing part of the mouth, which may be confusing forever, is gonna help us to see confusing joint motions. And to see what's actually happening here and not be distracted.
Yes, sir. Okay, perfect. Thank you. I appreciate it.
I had a question.
Come on.
So also some hosting class, is